And now, here's a thing about the TD-DMPS that's unique. Like, so DMPS can also be given orally. It has less of that redistribution problem than the MSA. It can also be injected. That means in that form it can bypass the gut in all those places that hold large amounts of toxins and go straight in the blood and have a stronger chance of getting into the brain without picking up a lot of metals on the way.
Okay.
That is the method that was used for 30 or 40 years. However, we found out about 10 years ago that by injecting DMPS into the surface of the skin, that it would be taken up because it is a neuroaffinitive substance, similar to a neurotoxin. Yeah? When you put DMPS anywhere, it will be taken up by the nerves in the neighborhood because it has an affinity to that, or the nerves like it, they have an affinity. And the DMPS, when I put it in the skin, is a small portion is taken up by the lymphatics, but the large portion of it is taken up by the nerve endings that are in the skin and travels from here to the spinal cord. It takes about 24 hours. We did a radioactively marked experiment with that. And then within another 24 hours, the DMPS is in the brain. So we know since 10 years that by injecting DMPS in the skin, in the surface of the skin, it's a direct route of getting it into the central nervous system. And of course, now this is where the
Just a quick side note, this explains Dr. Neubrander's work with the folinic acid, methyl B12, and I think NAC that they're doing subcutaneous, like every couple days. And I think he thinks, I don't know what he thinks, but I think the assumption is that it's just kind of a time release sort of thing, but it sounds like they're getting it where you need it.
Well, the same criticism I would have with Buttar, that he's created something beautiful, but he doesn't have his theory quite right. It would be, if I had a criticism. The same with ACAM, that a beautiful therapy, but they got their theory wrong, and because of that it was misunderstood and not utilized properly or in the right circumstances enough. And the same with the injection of folic acid and B12. If they would inject it into the skin, it would be 1,000 times more effective because it goes straight into the spinal cord.
Well, that's what they're doing now, and he was really specific about it, that if it's
it doesn't work. And this is unfortunately something I have not been able to be successful in teaching that to my American colleagues, but this is something that came out of the work with my thesis. You know, some of the experiments we did on the autonomic nervous system, how much it takes up substances in the skin is amazing. And so my working theory on the TD-DMPS is that by putting it in the skin, it is not a way of doing a non-invasive injection. Yeah, it's believed now, like when you rub it in, it's taken up by the blood and then goes in the blood and behaves exactly as if you inject it in the vein, and therefore you can do an intravenous injection without the needle stick. That's the current theory, of it. My theory is going much, much further than that, is that it is not doing it instead of the IV injection, but it is instead of injecting it intradermally in the skin. And when you rub the TD-DMPS on the skin, you get, because of its nerve affinity, direct uptake into the nerves. And it will behave exactly the same way that the injection did. Within 24 hours it's in the spinal cord, and within another 24 hours it's in the brain, mobilizing the metals exactly where the most disturbing. Yeah? Maybe for the video camera I have to say this: if you have an autistic child where the origin of the illness is mercury in the brain, there may be, if I kind of give a little relationship, there may be 100 particles of mercury in any given section of the gut, and there may be only one particle in any given section of the brain. The gut can tolerate the 100 particles. The brain cannot tolerate that one particle. And so when I give an oral agent for detoxification, it will maybe reduce the 100 particles to 90. There won't be any benefit to the patient. But that one particle that is dragged from here into the brain will make the patient twice as bad as the patient was before. Even though you're getting 9 out of 10 particles out, the one particle that you drag back into the brain, redistribution, will create much more harm than the gain that you've made. And that has been a problem with the oral detox done wrong. And therefore, in our book, we will give a simple sequence of how things should be sequenced. And that's why I like the title sequence, like the word
Tools,
sequence
synergy, and sequence.
in the title. Because it's just like cooking.
Yep.
It's exactly like cooking. Like when you make an omelette with mushrooms, if you putting everything in the pot together in the beginning, the mushrooms and the eggs and the thing, and then stir it, and you put it in a frying pan, yes, you get an omelette mushroom. But it's much nicer if you make the omelette first and do the mushrooms separately and then fold them into the omelette with the parsley in it, that it comes in later. And then at the end, you put your flour things on it.
You're making me so hungry.
It's a sequence, but it's the sequence that makes it a beautiful
Right.
meal afterwards.
And that's the goal of all of this, is for people to understand what's wrong, so then you can go into, well, what tools are there available to start to fix what's wrong? What synergy and sequence to make it all, that's the whole goal of all of this.
And so maybe for the before lunch,
Yeah,
to ending the discussion on the TDD-MPS for now.
sure.
The TDD-MPS is a way of getting DMPS straight into the brain, where the most disturbing part of the toxicity is,
Okay.
and removing the toxic metals and other toxins where it matters the most.
Okay.
And it's a way of bypassing all the other places of toxin deposits in the body without stirring them up to get into the brain first. And it is the most brilliant and simple method and the most important part of the treatment of autism. Other than part A, which should be first, is finding out where was the source of it and removing the child from the source of it. I do feel very strongly TDD-MPS has no place in a treatment unless you first eliminate where did it come from.
Well, I think it's only been in recent weeks that parents, especially parents of kids who they felt were regressive from the vaccines, felt confident they were away from the exposure.
Yeah.
It's only in recent weeks that they've started to realize that the vaccines were, like you said, a part of a much larger problem.
Yeah, and so I think what I want to do, with you for the rest of the day, get in the proper sequence of it. Yeah,
Okay.
which is let's look at the exposures. What are the 4 components of exposures that are there? How can moms identify them very easily, very simply? What can they do to avoid or remove themselves from it? Yeah, and then we look at really the part C, and I'm going to step out of sequence there and look at what are the detoxification methods that are available. Sauna therapy, colonics, TDD-MPS, and so forth. Let's look at the few tools that we have. And then we do the long part and kind of say, okay, now what can we do to fix the symptoms? To already make the child better today,
Right.
rather than waiting until the detox is complete.
And like Vinitsky's folic acid B12 protocol would fall in
Exactly,
there.
exactly.
And
All
Newbrander's.
all those things kind of fall in there, and that's of course a part where it's going to be my contribution is going to be limited, to some degree, in that, and you're going to have to add in your own knowledge and wisdom to that part. But I like to do it in that sequence.
Okay.
Exposures,
I want you to look at this.
detox. I have already.
Because I want to make sure we cover all those.
Yeah.
So we're done.